Hey there, ladies and gentlemen, and welcome to this week's Wednesday Wisdom. It's Dr. Patel with the Diabetes Free Life Group, and I'm happy to be here. Happy to bring you some news. I say news because one of the things that I've been doing over the last few weeks is giving you strategy, bringing you insight. Really, it's the insights that we use day in and day out in practice, and it's our best practices that we find through research, and it's the research that I want to bring to you because when you're talking to your doctors, they should be talking to you the exact same way. So when we talk about this research, you got to take that information and then implement it like we do with our patients. And when you do that, when you take that cutting edge information, what you do is you get pretty amazing results. Today, what we're going to be talking about is something that many of you experience, and unfortunately, that's joint pain, chronic joint pain. This includes things like osteoarthritis, rheumatoid arthritis, fibromyalgia, diffuse muscle pain syndromes. We're going to talk about all of them here today in our session. So they really share a common thread that I want you to know about and a common symptom. And what's that symptom? It's pain. And it's usually a lot of pain. And I want you guys to know that there is actually a common off switch to being able to actually shut off that pain that I want to go over with you here today that you need to be aware of if you're going through any of these issues, right? And I don't want to get too far ahead of myself here, but they all have this common off switch. And once you see it, and I'm going to be showing it here, you can't really unsee it. Anyway, I'd be remiss if I didn't mention something here, and it's the information, the strategy that we discuss week in and week out here on these Wednesday Wisdom sessions, and we put it all together in a neat presentation that we call the Diabetes Free Life Masterclass. The next one is going to be coming up in just a few short weeks, so make sure that you're on the watch for that. It's our free masterclass where we put all of this together, the viewpoints, the strategy, the action steps that you need to do to be able to walk away from diabetes, and it's really amazing. So it's taken my whole professional career to kind of whittle it down into these useful pieces that we use. The research has been able to show us, and it's something that we see day in and day out, and it works over and over and over again if you put the right steps in place. So we put together a free class for you, and it's going to start here in a couple of weeks, so make sure that you're on the watch for it. Don't miss it. I'm going to show you the tools. I'm going to show you the strategies that you need to do to take back your health control of it, right? So it's all in there. Anyway, back to the topic that we're going to talk about here this evening, and it's a topic about chronic pain, arthritis, osteoarthritis, like I mentioned, rheumatoid arthritis. What is interesting is that the medical literature knows that there's this communication pathway that sends pain to your brain, and that information highway is called your nervous system. Pain obviously travels through nerves, and nerves are like super information highways that send signals back up to your brain. You know, when the joint or the muscle or at the end of the nerve is not healthy, oftentimes there's the inflammation that gets present. And inflammation, like you guys know, we've talked about it so many times here, inflammation is like fire. And everybody loves a campfire, but I don't know anybody who loves a house that's on fire. And when we talk about these kind of conditions, many of you are living in a house fire right now. Inflammation drives up arthritis pain. It is like a house fire. It's destructive, it's frustrating, and it's definitely unrelenting. That's the house fire. And what happens is the joint tissue, the cartilage, the ligaments, oftentimes it's the tendons, it's the muscles that you can't afford to have going on your day-to-day without having these pains, and then all of a sudden it's causing irritation all over the place. And many of you know that. You know, too much inflammation for too long of a period of time, what winds up happening is these structures enter what we call demolition mode, right? And that demolition is like when you want to renovate your bathroom. If you guys have ever done something like that, you do renovation in your house, you first got to start with demo, right? You have to destroy it first. I don't know if any of you guys follow on HGTV, Chip and Joanne, but Chip loves to start off with demo day, Well, that's what happens inside of your body, right? So you destroy it first, right? Demolition mode is what happens when the inflammation, it doesn't finish. Inflammation is like a cycle. It's supposed to start, and then it's supposed to break down tissue. And then it begins to rebuild the tissue, like a sprained ankle. And you shouldn't have a sprained ankle forever, right? That's how it's supposed to work, but it gets injured, swelling happens, inflammation does its job, and the inflammatory cycle rushes this demolition crew in, and what does it do? It cleans up the damage, and then it starts to rebuild the area that needs to be rebuilt. It's just a cycle. right? You get the demolition, you get the inflammation, you get the demo crew, and then we get to rebuild, right? Just like Chip and Joanne, right? And it's a cycle. It's a cycle that happens in your house. But what happens for so many people that are dealing with chronic joint pain is the demolition crew never leaves. They never finish a cycle. Instead, what happens is they get stuck in demolition mode. Just constant breakdown of the once healthy joint tissue. They never get to the point where they're actually cleaning up. They never get to the point where they're actually rebuilding. And it's just this constant demo mode. And then they start to feel it. The nerves that run from the joint begin to get run over by inflammation, start sending all these pain signals up to your brain. And it's over and over again. And they're letting the brain know that they're not happy. Kind of like my 4-year-old when he's not happy and he's gotten kind of a rough go at things. Everybody in the house knows about it, right? So now what's interesting is that modern medicine has a lot of options to actually dampen the pain signal. And that's something else I want to talk about. And there's tons of meds that are out there that block the pain signals. It doesn't fix the problem. It doesn't fix this unrelenting joint demolition that's happening because of inflammation. But they've got a lot of options as far as medications that block that pain signal. Many of you, I'm sure, you've had these kind of medications, tons of lawsuits when we talk about things like opioids and the opioid epidemic, tons and tons of issues. These medications and their addictive qualities. Listen, we've talked about that story. You guys have heard about that story. But what I also find interesting is that modern medicine has an off switch for inflammation, and many of you may know it. Many of you have been using, and they're called NSAIDs, things like meloxicam and trazodone. Those are things that modern medicine offers you. It doesn't fix the problem again, but what is it doing? It is making sure that it helps you with pain, doesn't get rid of the problem. Or when those workers stop moving and into the heavy hitters, when meloxicam just isn't taking a bite out of the pain, or the trazodone isn't taking a bite out of the pain, those next heavy hitters, those are reserved for people who have cancer, but they use it for people who have pain, things like methotrexate. And those drugs, they're in that class. It's super interesting, but they're super intense. Problem with all of these, as you probably are all aware, is they're going to increase complications with increasing dosages, with increasing frequencies. There's always some kind of side effect. There's always some kind of complication with these medications, these issues that don't address the underlying problem. If they don't mess with your organs by taking some of these heavy duty medications, they wind up turning off your immune system. Back in the 80s, we had a different term for that. Maybe that's a different conversation for a different day. Anyway, the point here that I want you to be aware of, medicine doesn't have much to offer. After the body enters into this demolition stage, what winds up happening is arthritis starts to set in, and you get the arthritic changes, which is why so many diabetics are dealing with joint pains. You guys, it's wild. It's all the same problem. You've heard me talk for weeks and weeks and weeks, and if you've been following me for any period of time, you've been following me for years now, and I've talked about it. There's chemicals in our food and our environment that force the body into this demolition mode, these chemicals that drive chronic inflammation, and it's like gas on a fire. If there's something in your lifestyle, your environment, and it's pouring gas on your joint pain, then you're gonna have joint pain fire. You're gonna have blood sugar fire. You're gonna have blood pressure fire. I mean, you can go on with all the symptoms. You gotta find out why it's there in the first place, or the fire never stops. That fire, that demolition mode is what we've been talking about. It's actually a programmed response inside of your body. It's a response that your body, your DNA, your genetic makeup, that when you get exposed to these conditions, when you actually need to have something break down, your body will respond. But the problem is this, it's built to respond to these drivers of destruction in a normal way. But if you keep getting run over by these chronic conditions that we've talked about, environmental issues, food issues, these chemical compounds, well, that could drive very much this chronic pain syndrome. So there's two things that I want you to be aware of and I want you to consider. First is this, what's causing it? What are the chemicals? What are the foods? What are the triggers? What are the environmental things that you're being exposed to that makes your body respond in the way? You gotta find out what that is, what's pushing that into your body, that's keeping you stuck in this chronic demolition mode. Second, you gotta find out and how to interrupt the demolition cycle. You gotta find a way. And I'm gonna show you one of those ways here. You gotta find out a way to actually interrupt that cycle. Otherwise, though, you're stuck using those medications, and we all know that they all have side effects. Now, I've put a paper here together for you guys, and we listed it here in this post. In this paper that I found has been so helpful, this paper talks about something called curcumin, not turmeric, but the active ingredient curcumin. And it's going to interrupt the demolition cycle if you work with it instead of actually against it. And so what does that mean, right? It means that you have to do your part to avoid things like the foods, the environmental issues, the chemical toxicities, the trash that's just keeping everything on fire. It's like pouring gasoline on a fire. You have to identify those, and then you have to go about avoiding those. So that's step one. And then curcumin can be added as a support. And it interrupts these chemical signals that are constantly trying to sabotage your peace, right? I like to use high dosage of curcumin for about a week or 2 weeks, then slowly start bringing it back down, something that can be dosed every day to assist you in your efforts to stay away from that gas, the things that originally started making everything go on fire. You gotta stay away from those chemicals. It's a huge important thing. Otherwise though, things just continue to keep lit up, right? I find some people using turmeric, but it's not as helpful. I find some people already been trying to use curcumin, but they're like, well, the amount that they're using is kind of like squirting, I don't know, like a squirt gun on a fire. That'll never work. You gotta use enough that actually makes that cycle, that pain cycle, that destructive cycle that we're talking about here get interrupted. When you look for those chemical drivers of the problem, I hope it all starts making sense. Now, some of you might be asking, well, doc, how do I know what chemicals are causing my problem? Well, you gotta look. Right, you gotta look, you gotta do the work. And I show you where to look in the masterclass. Remember, that's coming up here in just a couple of weeks. It is a free masterclass. It's all there, you just gotta look. So 2 things, remember, right? First, find out the chemicals that are causing these problems in the first place. That's issue number 1. Second, you gotta interrupt that demolition cycle with enough of an intervention, like I was referencing here today, curcumin, right? That's not gonna wreck your organs. Not like all those pain medications that are out there that don't get you, something like this doesn't get you addicted to it. What does it do? It just does the job. We love it. We love seeing the amazing results that it gets. If you want to know more about this information like this, make sure you get registered for the upcoming masterclass that we're going to be having this month. Check it out. Thank you again for being here with me on this Wednesday Wisdom. Hey, I want to wish you guys all blessings, and I look forward to seeing you next week.